Richard, I'm excited for us to be talking today about Mental Health Awareness Month. That's May. May is Mental Health Awareness Month. Now, we first want to apologize that we missed the podcast last week. We were going to do this podcast last week, but sometimes life happens and interrupts everything that you have planned.
Well, in fact, it's been heartwarming in some ways because some listeners and viewers have been writing in saying, hey, where are you guys? We missed you. We got used to following you daily or weekly. And some people are saying, hey, what's going on? Let us know. Life happens.
It does.
What happened with life?
Whether we want it to or not, life happens sometimes. And so we were not able to record last week, but we are glad to be here this week to talk a little bit about Mental Health Awareness Month. What we do during Mental Health Awareness Month, again, is just to kind of bring the awareness about mental health issues. We look to sort of address, each week is a different focus. And so there's a week that focuses on child and adolescent mental health, a week that focuses on men's mental health, and so on. So, but we're going to talk about Mental Health Awareness Month in general, but we're also going to talk about a different article that emphasizes the difference between mental health and emotional health, because I think that is going to be a fascinating topic. Right.
We had begun preparing this podcast for Mental Health Awareness Month. We've been observing May as Mental Health Awareness Month since 1949. Right. Many people aren't even aware of that. And one of the things that we typically hear about during Mental Health Awareness Month are the statistics, that 20% of adults and 15 or 18% of children. The other thing we become aware of is that mental health issues are really issues that begin in childhood and adolescence and persist into adulthood. And then as we were doing the research, we suddenly ran into this article about not confusing mental health with emotional health. Right. That caught our attention. Yeah, and so while we want to acknowledge May as Mental Health Month, I think it's important for us to talk about the distinction. Some people don't make the distinction, but we think that it's an important distinction to make. Suddenly my eyes were opened a little bit, my vistas were broadened a little when I read this article. And so we wanted to pass this information along to viewers because it might be useful. Right,
because look, the idea, again, behind Mental Health Awareness Month, just like the ideas behind Autism Awareness Month or any other awareness, it is to help bring it to the forefront so that it's on our minds, because we need to sort of rid ourselves of the stigma, of the negative perspective of some of these things, and so that we bring it into the forefront of our conversation and express some of these concerns and issues.
And before we get into that distinction, just a final comment about Mental Health Awareness Month is that this year's campaign is about mind and body working together. Okay, and it's something that we practice here in our work, where we talk to our clients or our patients about the value of nutrition, sleep, exercise, and managing stress. Right. Okay? And that's what, as it turns out, that's what this year's campaign is about, is you have to take care of your body along with your mind. They work together, and you can't separate the two. And so this year's campaign stresses the importance of managing these four important issues and how they relate to keeping first of all, you keep a balance, but if you want to be mentally healthy, you have to be physically healthy.
Absolutely.
You can't do one without the other.
Yeah, so that integration of mind and body is really important, because for so long we had this sort of dualistic approach and perspective that the mind was somehow separate from the brain and separate from the body, and we know that those two things are actually very intricately connected.
And many people today are still living a life that they either abuse their body or they neglect their body. Right. Okay, either they're abusing it with drugs or alcohol or not enough sleep, or they're putting things into processed foods, sugars, those sorts of things that are almost toxic to your physical body are going to affect your mental health, because most of you have heard of the gut-brain connection, and if you damage the gut, you're going to compromise your mental health. I mean, you just can't avoid doing that.
Right.
You can also neglect your body if you
Right.
don't exercise or if you don't eat right, if the things you don't do. So if you're neglecting your body, that's a problem. If you're abusing your body, that's a problem.
Absolutely.
So that's what this year's campaign is about. Don't abuse, don't neglect your body, because otherwise you are going to compromise your mental health.
Absolutely. So, so as we're talking about that, I think that this is where the other article comes into play very, very nicely, because it differentiates mental health from emotional health.
Right.
And I think that the distinction is pretty important, because we tend to associate mental health with mental illness and that stigma of impairment and of some type of deficiency or deficit or being defective in some way.
An organic, brain-based deficit. Right. That's right. That's how we tend to think of mental health as something permanent and that you can't do anything about it. And for example, schizophrenia would fall into that category of something that's brain-based, and it doesn't get better over time. It's not going to come and go. We talk about things like depression, and it's funny when you read the statistics about depression, you always hear about at any one time, this many people will be depressed. But it comes and goes, You might be depressed for a time, and then it goes away. That's not the case with schizophrenia. It doesn't come and go. Anxiety comes and goes.
And what's important with that, and even with, but even if we think about anxiety and depression and some of those things, is that we do know that there are different types. So there is depression. We've all, most of us, the vast majority of us, have at some point or another experienced a depressive symptoms, if not a depressive episode. It didn't necessarily impair our functioning. It didn't keep us from going to work or anything like that, but we were extremely sad. We were withdrawn. We didn't want to interact with others. We didn't have any motivation. We weren't seeking pleasurable activities and those kinds of things. The same thing with anxiety. There are certainly times when we are all experiencing elevations in our stress levels to the point where we have some anticipatory anxiety and some stress about some event or something that we have to do. But that's not necessarily a mental illness. You can experience those things without having a mental illness or a mental health condition. And that's where we're falling into an emotional health circumstance. Where certainly there is something going on within our emotions that's making it difficult for us to deal with something or to cope with something that's happening in our life. And that is a very different animal than a mental health condition.
When I first encountered this article, it was one of those aha moments, because you're thinking, geez, I've thought about this before, but I never clarified my own thinking on the issue. And what happens to us personally is what you said, is that we periodically experience symptoms of any depression, anxiety. We all have those days or times or events that produce those sorts of emotions in us. And I think when I think about my but I'm not depressed. I mean, I don't meet criteria for clinical depression. Okay, I have some of the symptoms. I don't meet, but I don't get a diagnosis. Then there are patients. We see patients, and there are some patients who have these sort of intractable, permanent conditions that just feel like they reside somewhere in their brain. Okay, that it doesn't go away.
Depression or anxiety. It could be any of those same things.
But there are conditions that we deal with that don't get better with treatment. I mean, you can medicate them and get symptom reduction. But it doesn't disappear. The illness doesn't disappear. You reduce symptoms.
You have to maintain treatment, because as soon as you stop treatment, that's when the symptoms return.
And we've all heard about people who, when they stop taking their medications, that's when they get into trouble. That's when suicide attempts or true impairment occurs. It's like high blood pressure. As long as you're taking your medication, you'll be healthy. But if you stop taking your medication, you're going to be in ill health. I had a friend who did that, died at 55, a really great artist. And he had high blood pressure, and he took his medication, he did fine. And recently we heard he stopped taking his medication and he was dead at 55. Okay, so it's the same with mental illness.
Right.
As long as you're taking your medication, you get symptom reduction, and you can live a better life, a higher quality life, and the people around you can do that.
Right.
Okay, so those are mental health issues.
And you can tell the difference, we can tell the difference therapeutically when we're working with some of these individuals because, people with mental health conditions, you can, when you're interacting with them, when you're providing treatment for them, you can tell that there's a mental health related vulnerability. They're more, they're a little bit, it's a little bit more difficult trying to employ different strategies with them because they are because the way that the mental health condition is working within them, and it's, again, like you said, a very organic based perspective, as opposed to those people who have some emotional health issues.
Right. That's right.
You don't see that same vulnerability. You don't see that same level of need or sensitivity or anything like that when you're providing treatment for them, because overall they're sound, they're solid, they're healthy. It's just that they're dealing with something in their life that's causing them to kind of struggle a little bit, and they just need help through that one, that time in their life.
And they respond to treatment.
Always.
I think the other thing about the mental health is it responds to treatment.
Right.
Okay, and you can just feel people getting better as they sort through things, and it almost, if you select the correct intervention for that person. Some people like to do visual imagery and some don't. Some like to do yoga and some don't. So you have to pick the right intervention for that person. But they respond to the intervention.
Right.
Whereas people who have mental health issues, for example, a person with bipolar disorder, if you have organic bipolar disorder, you're going to have manic episodes.
Right.
And unless you're taking medication, you're going to have manic episodes. Right. You can reduce the manic symptoms, the symptoms of mania, but you're still going to experience that. And if you stop, you're going to have a complete return to symptoms.
Right. Now, and I wish that I would have had, like you said, it's an aha moment reading this article. I wish I would have had this article 3 or 4 years ago. Because I think that I would change, and I'm still trying to figure out how I can change some things in the way that I work, because people with mental health conditions, they need a therapist, they need a psychologist, or they need a counselor to help them through, dealing, trying to build some skills and everything to deal with those issues. A person with emotional health, they don't need a therapist in the same way. They need a coach. They need just somebody to support them, to help encourage them, and to say, hey, this is try this path. But it's not the same type of it's not like you need the cardiologist. It's just, you just need to take some deep breaths and you're going to be okay.
Right. And that's along that same vein, a person with a mental health issue, bipolar disorder, schizophrenia, or any of the personality disorders, but mainly those real deep, what we consider mental health issues, you take medication, and so you get symptom reduction.
Right.
The non-drug interventions are mainly designed to help you manage the other difficulties that you encounter in your life. Okay, how do you relate to other people? How do you do your job?
Right, because
how do you manage your life?
Right, because the medication doesn't solve all the problems.
No,
you still have to interact with people. You still have to solve problems and do those kind of things. And so the therapy that we do then is to help deal with life. While the medication is helping you deal with the symptoms.
Right. Whereas an emotional health issue is something that the therapist and the patient can ameliorate the depressive symptoms, and they will go away.
Right.
Okay.
Yeah.
So you will have a return to normal functioning.
Right.
Okay?
Absolutely.
So that a person who has performance anxiety, for example. Well, you deal with athletes, okay? And so high-level, high-performing athletes, elite athletes, will frequently encounter emotional turmoil of one type or another. You help them deal with that, and it goes away. They learn how to manage it so that it goes away, okay? It's not a permanent condition. It doesn't require ongoing medical treatment, okay, as bipolar disorder does. And even if they're on an antidepressant, if they stop taking it, you can replace the medication with other interventions, which is what we try to do. But those are emotional health issues, okay? And I think that's another good distinction, is that when you work with elite athletes, you actually get rid of the anxiety. You know, they learn how to manage it, and they get rid of it with or without medication. Okay.
Yeah,
you can't do that with bipolar disorder.
And I think it's unfortunate that we work in such a when we work in such a pathology-based world right now. You know, everybody wants a diagnosis. Well, not that you want a diagnosis. It's you're looking for a diagnosis to explain what's going on, because for some reason we believe that if we have a label to attach to it, that validates it, and that makes it a real thing. And so now all of a sudden, you know, it's not because there's something wrong with me. It's not because, well, it's not something that I'm choosing to do. It's something organic. It's something that's outside of my control. You know, it's the disease model of alcoholism, for example.
Exactly.
You know, it's outside of my willpower that this is happening, and so I need treatment. You know, I may need to help with these things, but it's not that I'm doing something to cause this. And we need to shift that to the perspective that, you know what, it may just be some circumstantial things. It may just be some things happening in your life right now that we just need to, you know, sort of tweak a few things, adjust a few things that's happening in your life, and that may make all the difference in the world for you.
That's right.
And you're not mentally ill. You don't have a mental health condition. You just are dealing with some emotional things that's throwing you for a loop a little bit.
And the other thing that we talk about here is stigma. Okay, because part of the problem is people have this stigma of mental health, you know, that I have a mental health problem. Most of us don't have a mental health problem. We have an emotional health problem, okay? And yet the stigma has, we've developed this, I think the stigma has occurred, has insinuated itself, because we tend to think of mental health as somebody who needs to be institutionalized, somebody who is so mentally ill that they can't function, or that they're frightening to the rest of the world. Most of our issues are not mental health issues. They are emotional health issues. But people are reluctant to seek treatment because they're thinking, well, I have a mental health issue. And you don't. You have an emotional health issue. And there we enter the world of social policy issues. Because you take the typical, here's a perfect example. In the military, if you're a pilot, or if you're a highly trained technician of some type, but typically pilots, you can't go to a psychologist and say, I need a few days off because I'm getting stressed. If you do that, you have lost your wings. They're taken away, okay? Because your need for rest is equated to a serious mental health issue, and you can't be trusted. So it's the same, it's that way with work. You know, you automatically get this. Or let's take what's happening in schools. Most of the children who are coming to our attention in schools have emotional health issues. Very few have mental health issues, and yet they and their parents are still reluctant to get help because they're thinking, well, I don't want my child to be labeled. And your child shouldn't be labeled. There shouldn't be a diagnosis. But the way our system is set up, there were places where you and I have worked where we had to make a diagnosis,
we still do.
Even when we didn't have one. It wasn't a diagnosis. It was, this kid just needed a little tweaking.
Which is one of the reasons why I use the diagnosis of an adjustment disorder most commonly, because what we're saying there is that there's something happening in the kid's life, in the person's life, that's you know, messing with them emotionally, or with anxiety, or with their behavior, and we just need to address that stressor. And once we address that stressor, the diagnosis goes away.
They're going to be fine.
And so that's, you know, that is one way that we can sort of work within the system while not necessarily doing this massive diagnosis that's going to stick with a person for the rest of their life.
And we typically think of youngsters and particularly teenagers as, you know, is it diagnostic?
Right.
In most cases, it's not going to be. Right. I mean, only 20% of teenagers really struggle deeply with adolescence. I mean,
Right.
most get through with a few cuts and bruises,
Right.
but only 20%. And of that 20%, even a smaller portion yet have a serious mental illness. Most
Right.
of them have emotional health issues.
Right, which is what gets us to the issue of statistics, right?
Right. That's
Because
right.
we deal with these prevalency rates that are really astronomical. I mean, we've talked before lots of times about the prevalency rates of ADHD, for example, and how they vary in different places. Where you have a country like France that has a prevalency rate of 2 or 3% for
Right.
ADHD,
Right.
compared to the southeastern United States, where the percentage rate is almost
Approaching
20%.
20%. Right.
And there can't be that much of a difference.
Not an organic disorder.
Organically, right.
Mhm.
So it's got to be something that's environmental.
Right.
And if it's something environmental, then we're probably talking more about the whole issue of emotional health as
Right.
opposed to mental health.
That's right. Even in the United States, prevalence rates vary from region to region.
Right, absolutely.
That's not disease.
Right.
That's there's something else at work there.
Right,
Okay.
right. So we have to keep that in mind when we look at the prevalency rates of some of these conditions, because it's probably not. And it makes sense when you think of something that's certainly organic, something like schizophrenia. Schizophrenia is certainly organic, and the prevalency rate is about 1%.
Right. That's right. Around the world.
Around the world.
Those are fairly stable rates across the globe.
But then you have ADHD that ranges anywhere from 2% in some places to
Right.
almost 20% in other
Or
places.
anxiety disorders,
Right.
or depressive disorders. So
Right.
you have those vast that variability in statistics, and that's a good indication that
Right.
we're not dealing with strictly an organic disorder.
Right. So there's something else going on. It's getting this formal diagnosis, but it doesn't necessarily mean that formal diagnosis is what's really happening.
That's right.
Many times it's just an emotional health issue.
Right. And I think this is an incredibly important distinction.
Absolutely.
Whether it's for you're looking at your children and you're saying, is this a mental health issue or is it an emotional health issue?
Right.
Get somebody to help you work through
Right.
that.
Yeah.
And
so
in
there's
your
something
own,
going on in your life, like a divorce, or
Sure.
that we are just going through. It's near the end of the school year, so everybody's going through the high stakes testing and everything.
college acceptance,
Right.
that whole.
If your kid is experiencing a lot of stress and anxiety right now, it's probably not a mental health condition. Right. This is probably just an emotional health thing that's happening because of the circumstances going on in their life.
Right. And so make the distinction, think about the distinction between mental health and emotional health. It's not recognized yet in any formal documents, but I think at a practical level, we ought to be thinking about it. I think it has important implications for the stigma against mental health. People aren't getting help when they really just need a little bit of fine-tuning once in a while. We all do. We all need some emotional coaching, some emotional work. It's not a mental health issue. So the stigma, the statistics, the treatment, the response to treatment, all those are important. And if we make this distinction, I think we're going to be in a much more productive, dealing with this in a much more productive way.
When more people are going to seek treatment.
Seek treatment, right.
And again, it's not treatment from a medical perspective, it's treatment from a psychosocial perspective of just, hey, I'm just going to coach you.
Right.
Let's get through this. So.
That's right. No, we have the luxury of working together, and so I can walk into Berney's office and say, hey, I'm really struggling with such and such. That's an emotional health issue. Yeah. Okay, it needs a little tweaking, need a little advice, and you move on.
Absolutely.
Okay? So, and we all should have that availability and luxury.
Absolutely. So, all right. Well, that is it for today. So, read the articles. The links to the articles are in the show note. And so, check those out. Great information. And we would love to hear from you if you have any questions, any comments, any thoughts about it. We're getting a lot of feedback from many of you out there through YouTube. Our subscriptions are really taking off. We're getting a lot more people checking us out there. Right. So if you're watching us on YouTube, make sure that you write to us. I try to respond to everyone. It's a little bit difficult, but I'm doing my best to try to respond to everyone. So if you have a question, if you have any thoughts or comments, send us something there. And if you have a topic that you'd like for us to cover, let us know, and we'll be there. So, all right. Well, that is it for today. Until next time, stay happy, stay healthy, and forget to be afraid.